Leg weakness is one of those problems that many people ignore for years because it often begins quietly and slowly, without pain or dramatic symptoms, yet it can deeply affect daily life if left unnoticed. Many people assume that weak legs are just a normal part of aging, tiredness or lack of exercise, but in reality, leg weakness is often the body's way of sending an early warning that something inside needs attention. Weak legs can reduce independence, increase the risk of falls, limit mobility, and affect confidence in simple activities like walking, standing, or climbing stairs. Understanding the early signs of leg weakness allows a person to take action before the condition worsens. The legs are complex structures made up of muscles, nerves, bones, joints, and blood vessels, and weakness can develop when any of these systems are not working properly. When the brain sends signals to the legs and those signals are weakened, delayed, or blocked, the muscles cannot perform at full strength. Over time, this leads to instability, fatigue, and loss of power. Paying attention to small changes can make a big difference in long-term health and mobility. One of the most common and often ignored signs of leg weakness is difficulty standing up from a sitting position. When the leg muscles are strong and healthy, standing up from a chair or bed happens automatically without conscious effort. However, when weakness develops, this simple movement starts to require extra effort, momentum, or even the use of hands for support. Many people notice they must push off the armrest of a chair, lean forward excessively, or rock their body to gain enough strength to stand. This is not just a sign of aging. It is often a sign that the muscles in the thighs, hips, and legs are losing strength. These muscles are essential for balance and stability, and when they weaken, everyday tasks become challenging. Over time, this can lead to reduced activity, which further weakens the legs and creates a cycle of decline. People may avoid standing frequently, limit movement, or fear falling, all of which accelerate muscle loss. This sign is especially important because it often appears early and worsens gradually, making it easy to dismiss until significant weakness has already developed. Another major sign of leg weakness is frequent stumbling or feeling unsteady while walking. Many people experience occasional clumsiness, but repeated tripping, dragging the feet, or feeling unstable on flat ground is not normal and should not be ignored. Weak legs struggle to lift the feet properly during walking, leading to poor coordination and reduced control. This may cause the toes to catch on the floor or ground, increasing the risk of falls. Some people notice they walk slower than before, take shorter steps, or feel unsure when turning or changing direction. Others feel as though their legs may give out unexpectedly. This unsteadiness often causes anxiety, which further affects walking confidence and posture. Balance relies heavily on leg strength, nerve signals, and muscle coordination, and weakness in any of these areas disrupts smooth movement. Over time, this can limit a person's ability to walk long distances, go outside independently, or perform daily errands, reducing quality of life and increasing dependence on others. A third sign of leg weakness is persistent heaviness or fatigue in the legs, even after minimal activity. Healthy legs recover quickly after walking, standing, or light exercise, but weak legs often feel tired, heavy, or drained after very little effort. Some people describe this sensation as walking through water or carrying invisible weights on their legs. This type of fatigue does not always improve with rest and may return quickly once activity resumes. It can make simple tasks like grocery shopping, household chores, or short walks feel exhausting. This heaviness is often linked to reduced muscle endurance, poor circulation, or weakened nerve signals. When muscles do not receive enough oxygen or proper nerve stimulation, they tire more quickly and lose efficiency. Over time, this fatigue encourages inactivity, which further weakens the muscles and reduces stamina. Many people mistakenly believe this fatigue is just normal tiredness. But persistent leg fatigue is often a clear signal that strength and function are declining. Another important sign of leg weakness is muscle cramps, twitching, or unusual sensations in the legs. While occasional cramps can happen to anyone, frequent cramps, shaking muscles, or involuntary twitching may indicate underlying weakness or nerve involvement. Weak muscles are more prone to cramping because they fatigue easily and struggle to maintain normal contractions. Some people experience tingling, numbness, or a burning sensation along with weakness, suggesting that nerves may not be communicating effectively with the muscles. These sensations may worsen at night, during walking, or after standing for long periods. Muscle control depends on a healthy connection between the brain, spinal cord, nerves, and muscles, and when this system is disrupted, the legs may feel unpredictable or unstable. Over time, these symptoms can interfere with sleep, walking comfort, and overall mobility, further reducing leg strength through decreased activity and muscle use. The fifth sign of leg weakness is difficulty climbing stairs or walking uphill. Stairs require strong leg muscles, particularly in the thighs, hips, and calves, and they place higher demands on balance and coordination. When leg weakness develops, stairs often become one of the first noticeable challenges. People may need to hold on to railings tightly, take one step at a time, or pause frequently to rest. Some avoid stairs altogether, choosing elevators or limiting outings that involve elevation changes. This avoidance leads to further muscle loss and reduced cardiovascular fitness. Difficulty climbing stairs is especially concerning because it reflects a loss of functional strength, which is essential for independence and safety. It also increases the risk of falls, particularly when descending stairs, where control and stability are crucial. Over time, this limitation can restrict living arrangements, social activities, and confidence in movement. Leg weakness does not usually appear overnight. It develops gradually due to factors such as inactivity, poor nutrition, aging, nerve problems, circulation issues, or chronic conditions. The body adapts slowly, and people often compensate without realizing it, using furniture for support, walking more cautiously, or avoiding certain movements. While some decline in muscle strength can occur with age, significant weakness is not inevitable and should not be accepted as normal. Muscles respond to use, nourishment, and proper care at any age. Ignoring the early signs allows weakness to progress, increasing the risk of falls, injuries, and loss of independence. Awareness is the first step toward improvement. By recognizing these signs early, individuals can seek guidance, improve activity levels, support muscle health, and maintain mobility for longer. Strong legs are essential for a healthy, active life. They support the body, protect joints, stabilize movement, and allow freedom in daily activities. When leg weakness begins to interfere with routine tasks, it is a message from the body that something needs attention. Listening to these signals rather than ignoring them can prevent long-term complications and help preserve strength and confidence. Leg weakness is not just about muscles. It reflects overall health, circulation, nerve function, and lifestyle habits. Paying attention today can protect mobility tomorrow.